Ani Buju, this is McGeezy. I want to talk about why I had to cancel my Cleveland Clinic appointment. I had scheduled to get a rental car. I was unable to get the rental car because I didn't have a utility bill in my name. I tried to use the phone bill, but it was attached to my old address. Provider Xfinity said go into the store and change your address there, but need to provide support documents. I arrived at the store via bus, which took 1 hour. Store people said they couldn't help me unless I was willing to sign up for internet again, because it's bundled internet and mobile together, and when you cancel the internet you can still keep the mobile, but it's tied to that internet. I explained I didn't have legal permission because I don't own the house. Plus, we already have AT&T fiber optic internet. Also, they further said it would take 1 billing cycle to fully change my address, even if I did sign up for internet with them. So 1 full billing cycle, 30 days, needed the car today at 5:30 to drive to Cleveland for my appointment tomorrow. I'm fighting so hard to get help and to get a feeding tube. So far, I've lost 22% of my body weight unintentionally in less than a year. Last May, I asked my surgeon for IV hydration, knowing that I had a medical issue. I have Sjogren's, which is basically an autoimmune disorder that dehydrates you. My surgeon's office suggested Vivid IV, which is a bougie place that those who want to get a top-up or help with a hangover or just get fluids, and it's $150 per IV. I have been asking every specialist I see, one, because I know about document, and no one has been willing to write the script. Local Facebook pages of my chronic illness groups that I'm in said any doctor can write the script, but I was told only cardiology. This is what led to the malnutrition and malnourishment and led me on this journey. I actually started my journey of malnutrition before this, to be honest. I started to severely lose weight. I was having vomiting, nausea, and issues with enuresis and encompresses. That means my body was voiding my bowels and bladder without my desire or willingness or even trying to prevent it. Since my 20s, health providers who have reported having my bowels be loose without me being in control, that this was normal, and then in the same breath lose weight. I was weight stable at 376 when I had my panniculectomy in Wisconsin with Dr. Bird. That is where they take the apron of skin off your abdomen area. They took 20.5 pounds of skin and tissue. Had a 38.5-inch incision from hip to hip. I dropped to 340 after that and was weight stable for a while. And that was at March of 2022 when I had the surgery. Then I started experiencing weight loss and noticed more significant unintentional weight loss really began in May of 2024. I started to rapidly lose weight, which at first chalked it up to diet change, because I went to a low histamine diet to manage my MCAS, which is mast cell activation syndrome. When I started with my hematology, just again after moving back to West Michigan from Ypsilanti, she remarked the last time she saw me, which was less than a year ago, I was 89 pounds heavier. And She then tested me for mastocytosis, but it was negative because MCAS can migrate to your bone marrow. Again, kept losing and was losing food. I had previously had steak and oatmeal, but then had my entire left leg and left foot go numb when I started to have a serious reaction. Next time I had steak, because I thought that was a fluke, my whole entire left leg, left foot, and right foot went. The end of August, I had anaphylaxis to the gluten-free oatmeal I was eating. And that was my last food. That was the only food I was consuming. I had to do 2 EpiPens, 1 in each thigh, and still had reaction. When I was in Portland 2023, I had MCAS flare, a severe one, hospitalized 5 days, 4 nights, had 5 rounds of Epi, and then a continuous bolus of Epi, and was still having reactions because MCAS is not IEG reactions. Now I'm drinking liquid formula and had urgent referrals to Cleveland Clinic and U of M Ann Arbor. So it was devastating to have my transportation be the reason I needed to cancel. I was willing to do the additional $300 deposit because I needed to use a debit Visa card. I even went there to make sure I had accurate information of the stuff I needed to check out the rental car when time came today. Spoke to my partner about bringing stuff to them that they needed because they're currently hospitalized for also a feeding tube. I couldn't take it to them because I couldn't rent the car. So I told their parent and their other partner, because polyamorous, to figure it out with their sibling to who could get it to them. I had lost 10 pounds while in the hospital with my partner just from last Thursday to Monday. But because I was there and they only see fat person, my BMI when I started my entire journey as an adult trying, this is when I was trying to lose weight. My BMI was 82.4. My BMI currently is 38. Still obese, but no longer morbidly obese. Doctors still see me, even though I got sunken in cheeks and jowls from unintentionally losing weight that I'm fat and still could lose and not to help. Especially whenever I brought up my concern, they would give mental or verbal